Assalamu alaikum and welcome to the Dr. UT lectures. Today's topic is about the electrocardiogram. In this topic, I will tell you people, I will brief you guys about the P waves, the QRS complex, the T wave, the PR interval, the QRS interval, the QT interval, and like that. And I will also direct you to another video of ours in which we have explained a question that I'm going to ask from you guys during this video. Anyways, so P wave, then we have QRS complex. P wave actually tells about the atrial depolarization. We know that heart is having four chambers. Upper chambers are called atria, the lower are called ventricle. So the atria, they depolarize, the P wave is generated. Then this kind of distance is achieved, which is given the name as PR interval from P to R. Then from here, another shoot up is actually observed, then shoot down. So this actually represents the QRS complex, and this complex is actually telling us about the ventricular depolarization. What? Ventricular depolarization. Upper chambers are called atria, lower chambers are called ventricle. So atrial depolarization is told us by P wave. Then we have this particular portion which tells us about the ventricular depolarization. Then there is a little bit flat, again wave is actually seen, which tells us about the ventricular repolarization. Ventricular repolarization, ventricular depolarization, atrial depolarization. Now a question that should be asked by the students is, where is actually the atrial repolarization? We did not see any kind of repolarization hereby. So where is actually atrial repolarization? For this, you are supposed to watch my another video. I will just drop the link of that video in the description. So first of all, let's complete today's discussion. That is about the PR interval. Remaining portion is actually about the intervals. So PR interval is actually the time for the impulse to travel from the atria to the ventricle. Okay. So from the atria, when here is a depolarization observed, then the current is supposed to move. Okay. So that time is actually for the impulse. This is actually the time for the impulse. So this time is actually taken by the impulse to reach the ventricle. From the atria, the impulse is generated, and the impulse will then reach the ventricles. So the ventricles, as it is reaching the ventricles, this take a little bit time. So this impulse actually takes a little bit time. That impulse time is actually called as PR interval and shown here in the graph. So P wave depolarized from P to R interval is actually the time the impulse is flowing towards the ventricle, and QRS actually tells us about the ventricular depolarization, and the QRS interval from Q to R, this particular S, from Q to S, this particular portion is actually telling us about the time the impulse is actually flowing through, time taken by the impulse to reach His and Purkinje fibers. So we know about the heart. So in the heart we have two chambers, atria and ventricle. So then here we have sinoatrial node, then atrioventricular node, then bundle His and Purkinje fibers are actually observed hereby. So this QRS is actually telling us the time taken by the QRS interval is actually telling us the time taken by the impulse to reach His, Purkinje and ventricles. So His, Purkinje and ventricles, sinoatrial node, atrioventricular node, bundle of His and Purkinje fibers, then ventricles are there. So this particular portion, QRS interval, is actually telling us the time. It is actually telling us the time taken by the impulse to reach the entire portion of the remaining portion of the heart, like simple bundle His, Purkinje fibers and ventricle at the end. So then what is happening is that then from the S there actually starts a little bit flat portion, then the T wave is there. So T wave, we know about the T wave, it is actually the ventricular repolarization, but the distance between this particular portion, the Q and T, this is actually named as QT interval. Now this interval is actually telling us about the cardiac repolarization time. This is the time in which the cardiac repolarization takes place. So I hope you got the atrial depolarization, ventricular depolarization, ventricular repolarization. The point is atrial repolarization. Where is that point? In another video. You have to watch that video. I will just drop the link in the comment box or in the description. Anyways, interval, PR interval is the time that takes place, the time that is actually consumed for the impulse to reach from the atrial to the ventricle. And then we have QRS complex. This is actually telling us about the time taken by the impulse to reach the his Purkinje fibers and ventricles. So we have as SA node, AV node, then we have bundle his Purkinje fibers, then we have ventricles. So the time taken to reach the ventricles from the his to bundle fiber, his to Purkinje to ventricles, his Purkinje ventricles, his Purkinje ventricles. So the time taken is actually known as the QRS interval. And then we have the time taken for the cardiac repolarization is actually QT interval. So these are about the intervals, the points about the intervals and the discussion with you guys. I hope you got. If still you have any kind of confusion or questions, drop that in the comment box, and don't forget to watching the video that is regarding the question, where is the atrial repolarization? Okay.